So, Bismillah Rahman Rahim, and welcome to Ordinary Days. In this video, we will discuss chapter number 25, which is about the renal physiology. And we will begin this playlist by first studying about regulation of body fluids. Our body is made up of 60% of water, that makes a total of 42 liters. Now, our body needs to conserve this amount of the fluid that is placed in it. Fluid intake must always match the fluid output to maintain homeostasis, that is, to maintain normal body fluid concentration. So, if there's increased retention of water, for example, your body is not producing enough urine, what will happen? There will be excessive accumulation of water or edema. But when there is decreased retention, you are producing a large amount of urine, then there will be dehydration. So, intake of the fluid must always match the output of the fluid. Now, let's discuss what amount of the fluid do we intake per day. Like ingestion in the form of liquids, in the form of water, we take it 2100 milliliters per day. And certain amount of water is synthesized by the oxidation of carbohydrates, and that is a total of 200 milliliters per day, making 21 plus 2 makes 2300 milliliters. Now this 2300 milliliter must be equal to the daily loss, that is, loss of water must also be equal to 2300 milliliter. Let's have a look at different possibilities. Now, first of all, we have insensible loss which is not which the body cannot feel. Then we have sweat, the feces, and kidney loss. Kidney loss is by urine. So first of all, we will discuss the insensible loss, the loss that body cannot feel. The loss is by the respiratory tract via evaporation, and from the skin by diffusion. Apart from sweat, the diffusion loss of the water, it also takes place in the people who do not have sweat glands. So this skin loss is 300 to 400. This evaporation by respiratory tract is also 300 to 400, making a total of 700 milliliters. Now, this loss by the skin by diffusion, it can be minimized by cholesterol filled cornified layer of skin. For example, you have skin, and if you have cholesterol, that cholesterol is going to limit your water loss by evaporation. That is why this is a barrier against excessive loss by diffusion. But in people who are burned, for example, they undergo a type of accident and their skin is burnt, that portion of the skin which had the cholesterol filled layer, now that is destroyed. That is why in burn patient we are supposed to give them intravenous administration of fluid or IV fluid drips. That was all for the skin loss by diffusion. Now we have the loss by respiration. This respiratory loss is also 300 to 400 milliliters per day, but it is increased in cold. Let's see what happens. Now the air that is inhaled in through your nose, that air is dry, and we need to moisten it according to our body temperature. So to equalize it to the body normal vapor pressure, we need 47 millimeters of mercury vapor pressure of that incoming air. That is why we add water to the incoming air to moisten it. In this way, when the air is expelled out of your body, it carries that water out with it itself. So that causes a loss of 300 to 400 milliliter per day. What happens in cold weather, that the atmospheric vapor pressure, it decreases so much that it becomes closer to 0 degrees. So now to moisten the air, we need a total of 47 millimeter of mercury vapor pressure in the incoming air. This type of vapor pressure is going to help the body to equalize the external versus internal type of the pressure. Now, what happens in the cold? You feel more dry in your respiratory passageway. Why does it happen so? Because a large amount of water is being lost to accommodate for the atmospheric vapor pressure versus the body vapor pressure. So both the insensible losses via respiratory and via the skin, they make a total of 700 milliliters loss. Then fluid loss in sweat and fluid loss in feces, both of these losses are 100 milliliters per day. But loss in the sweat, when you are in a sunny day and when you are sweating a lot, you're going to lose 1 to 2 liters per day. That is a large amount. That is why you need to have a large intake in summers to accommodate for this fluid loss in sweat. Similarly, the loss of water through feces, normal is 100, but when you are having excessive diarrhea, there is severe loss. That is why you are going to give intravenous administration of fluid to a diarrheic patient, and you will ask them to take water with electrolytes to conserve that water in your body. Now you have kidneys. The normal urine that kidneys produce, it can be as low as zero point 0.5 liters to as high as 20 liters. The zero point 0.5 liter is the amount of the fluid that has to be excreted in the form of urine. That is a complementary, or you can say not a complementary, but the fluid that needs to be produced, the urine that needs to be produced, that is supposed to be produced. And the 20 liters is like an overly hydrated person, but normal fluid loss is 1400 milliliters per day. And this fluid loss depends upon the amount of electrolytes you're taking in. For example, if you're taking sodium chloride and potassium more, then body is going to conserve more amount of water and less urine will be produced. So it depends upon the electrolyte intake of a person as well. In certain people, when they are taking 20 milliequivalents of sodium, what will happen? There will be large amount of fluid produced, large amount of urine produced. In people taking large amounts of sodium, there will be large amount of urine. In people taking low amounts of sodium, there will be low amount of urine. Sodium intake is directly proportional to the urine, inversely proportional to the urine production. Now, kidney, it matches the intake of the electrolytes with the loss of the fluid. So, if you are taking more electrolytes, then kidney has a mechanism to excrete out those electrolytes as well. But in doing so, kidney is damaged as well. That is why in hypertensive patient, you ask them not to take a large amount of sodium, or decrease the amount of sodium in their diet so the water is not retained in their body and edema does not develop. Now, this balance of intake and output, as I told you, the intake was 23. So let's calculate the output balance. Insensible, sweat, feces, and kidney. Insensible is 7, sweat is 100, feces is 100, but kidney loss by urine is 1400. That makes a total of 2300. So this balance has to be maintained at all the times to prevent edema or to prevent dehydration. Now we have fluid compartments. As you know, our body is composed of 60% of water, and that water is 40 liters or 42 liters. Now this water depends upon age, it depends upon the gender, it depends on the level of obesity. In Let's discuss about the age. No, practical. In age, a person who is older is having greater amount of fat and hence low amount of water. In women, because they have more body fat, what will happen? The amount of water in their body will become 50%, and the fat will also be 50%. In obese individuals, in which there is large amount of fat, there will be less amount of water stored. And in babies, the amount of water is large because they have less fat, so it is 70 to 75%. Now this fluid that is outside the cell, it is known as extracellular fluid, and the fluid which is inside the cell, it is the intracellular fluid. The intracellular fluid is 28 liters, or you can say 40% of the total body water, whereas this extracellular fluid is 14 liters or 20% of the total body water. Now, this extracellular fluid is further divided into three compartments. Two are major and one is minor. Major compartments are interstitial fluid that makes 3/4 of this 14 liter, and blood plasma that makes 1/4 of this 14 liter. So 3/4 make 11 liter, whereas this blood plasma makes 3 liter or 1/4. And another minor compartment is the transcellular fluid, that is the fluid in the synovial cavity, peritoneal, pericardial, and cerebrospinal cavity. All the fluid in different compartments of your body is transcellular. So, of the total 42 liters, you have two compartments. One is 28 liter, making the intracellular fluid. Other is 14 liter, making extracellular fluid. This extracellular fluid is further divided into 11 liters interstitial and 3 liters blood plasma. Now let's talk about plasma. This plasma is the portion of the blood that is non-cellular part of the blood, and as you know, plasma makes 3 liters of the total extracellular fluid. Now plasma has pores in the capillary membrane through which it is having a communication with the interstitial fluid. And in this way, they exchange the substances. So there is the exchange between the plasma and the interstitial fluid through the pores in the capillary membranes. But these pores allow only small particles to pass through, but proteins cannot pass. So proteins are accumulated within the plasma. And when proteins are accumulated within the plasma and they have a negative charge, they are going to pull out the positively charged particles from the interstitial fluid into the plasma. So this will cause a greater excess of electrolytes within, or positive electrolytes within the plasma. Also, the major thing about them is the Donan effect. Donan effect is actually causing more positive ions in the plasma, that is 2% greater. Why is it happening so? Because as you know, these the separation between plasma and interstitial fluid is by a semi-permeable membrane. So two ionic solutions separated by semi-permeable membrane, which allows some ions to pass through. As you know, positively charged ions are moving inside but restrict the other. So the type of thing that a plasma membrane is restricting the flow of certain particles but allowing the flow of other particles, it causes unequal distribution across the plasma membrane. Also, the other fact is that these negatively charged protein molecules, they will attract positively charged electrolytes but they will repel negatively charged electrolytes. So positive is greater inside and negatively charged electrolytes are greater in the interstitial fluid. Now we will talk about blood volume. Blood volume has to be very important because it forms 5 liter in your total body fluid. But this is divided further. The fluid inside the red blood cell, it is the intracellular fluid. But the fluid that is outside the red blood cell in the capillary, that is extracellular fluid. And that makes the plasma. That is non red blood cell part of the, or non-cellular part of the blood. So this is how the fluid is distributed within your blood portion, and that makes a total of 5 liters. Now we have hematocrit. Hematocrit is fraction of the blood composed of red blood cell. So if you have total this much blood, so how much are the red blood cells of this total blood is the hematocrit. How do you measure the hematocrit? You are going to centrifuge your blood in a hematocrit tube that will cause the blood cell to settle in the bottom and plasma to rise upwards. That type of situation will help you to separate your red blood cells from your plasma, and then you can calculate which amount of the total blood is the red blood cells. That is hematocrit. A true hematocrit is 96% because some amount of the fluid is also entrapped within the cells or between the cells, because there is spaces between the cells that are also going to entrap the fluid. Now in men, because that testosterone, it has positive feedback onto the red blood cells, so red blood cells will be more, whereas estrogen has negative feedback, so in women red blood cells will be less. So in men, the hematocrit is 0.4, in women it is 0.36, but in anemia patient it can drop to 0.10. But in polycythemia, that is irregular production of abnormal red blood cells, it can rise up to 0.65, and it will cause greater thickness in your blood, and your blood will be thick and jumbled up. So that is the first portion of our chapter number 25. In this next video, we will discuss the second portion of chapter 25, that is regulation of body fluids. Please like, share, and subscribe to my channel, and we'll meet very soon, inshallah.